Hey there, folks. I'm Eric Osberg, and this is another Rural Rebound video, Rural by Choice. And today we're going to talk about uh, job opportunities in Ottertail County, Minnesota. We're going to talk about why some people like to live and work here. And joining me now is Katie Johnson. She is the VP of Marketing, and I forgot the second part, communications, marketing and communications for Lake Region Healthcare. How are you doing, Katie?
I am great, Eric. How are you?
I'm pretty good. Thanks for asking. So tell us about Lake Region Healthcare. Why should somebody want to work at Lake Region Healthcare?
Boy, that's a big question. It's obviously a challenging time to work in healthcare, but it is also an extremely rewarding time to work in healthcare and an exciting time to work at Lake Region Healthcare, in my opinion. We are growing and we are um, privileged to work in a community that has embraced local independent healthcare, a community that supports the providers and the staff here in just an amazing way, and who make us feel really privileged to be here in the community to provide their healthcare needs. So, if you're the kind of person that likes the feeling of purpose, the feeling of helping, of serving, of kind of leaning in when times are hard, when people need you, this is a great place to work.
So and I know you don't, or maybe you do, but you might not know every job that's available right now. But what are the types of careers that if I was digging into a career at Lake Region Healthcare, what are the
Yeah.
types of careers that you guys have available right now?
That's one of the things that I think is so cool about healthcare is we have jobs in almost every type of career area. Not just direct patient care. Of course, we are always looking for RNs, LPNs, CNAs, the various nursing specialties always in demand, as well as physicians and advanced practice providers. We're, always recruiting for primary care and specialty providers. But beyond that, we have careers in patient access, patient registration, helping patients register, find their way to the right provider. In food service, preparing food, delivering food. Um, we have careers in finance. We employ CPAs, CFOs. We have careers in human resources, in IT. Healthcare IT is an amazing field with huge demand. We have careers in EVS, maintenance, materials. If you like fixing things, boilers, all those kinds of careers. Marketing,
Right.
communications, right? Foundation, philanthropy. We have careers literally in almost every area that you could imagine, and in a very rewarding and family-like atmosphere.
And I don't need a specific number, but about ballpark, how many people does Lake Region Healthcare employ in the area?
Yeah, so we have about 1,200 employees, and Lake Region Medical Group has about 120 physicians and APPs. So well over 1,000 of us at locations across Ottertail County, Grant County, Stevens County. We have even our clinic in Barnesville in Clay County. So we have 11 different locations, and like I said, about 1,200 employees and 120 or so providers.
That's a lot. I
It
knew it was
is.
I knew it was a big number, but
Yeah,
I didn't know it was that big. So let's talk a little bit about you, Katie.
sure.
Why? I mean, I think you've kind of explained why you like to work at Lake Region Healthcare, but you live in Fergus Falls, right?
I do.
Why Fergus Falls? What do you like about Fergus Falls or the surrounding area that has convinced you to create a life there?
Sure. So I grew up in Battle Lake. I went away to St. Paul to college to get my broadcasting degree and had every intention of moving to New York and being the next Katie Couric. That was what I wanted to do. And I did my internship at WCCO TV back in the day, and maybe was a little bit less convinced that I wanted to be in big market broadcasting because I realized how cutthroat it was. But I came back home after graduation to work at the radio station here just long enough to find the job in a TV market somewhere else. But it didn't take me very long to remember why being close to family, why living in the lakes area where there's so much outdoor beauty and activity, um, to realize that this was a good place to settle and to build my family. So I lived outside of Underwood with my husband and 2 kids for 25 years before moving into Fergus just the last couple of years. I love Otter Tail County. Like I said, I love the combination of outdoor beauty and activity to enjoy all 4 seasons in various ways. And I just love the sense of community here. People care about each other. I care about my neighbors, and I like living around neighbors who care about me and my family.
So winter's coming up. You mentioned, it's just a little cold today. Winter is in the air. What are some things that you do personally during the wintertime to get outdoors? What are some outdoor activities that you enjoy in the wintertime?
Sure. I believe that I think this is maybe originated in Norway. There's no such thing as bad weather, only bad clothing. So as long as you're dressed for it, winter is awesome. Our family loves downhill skiing. I like snowshoeing. I live close to the M State campus, and it's a great place to just pop the snowshoes on at home and snowshoe around there or out on the 1 mile trail. We love taking our dog out there and snowshoeing and hiking in the winter. So both cross country and downhill skiing and snowshoeing are probably my favorites for winter.
Fantastic. And it's good exercise too. So it kind of leads into that healthy lifestyle for.
Exactly.
So if somebody's interested, if somebody wants to learn more about Lake Region Healthcare, the opportunities that are available, where can they get more information?
Yeah, just head over to our website, lrhc.org. We have a careers tab that talks about all of the opportunities that we have, or give us a call. Our human resources department and team is always ready to talk to you. They can tell you about some of the sign-on bonuses that we have right now, particularly looking for people in athletic training, patient access specialists, and again, nurses. If you're in any of those careers, we'd love to just have a conversation with you about what that might look like. And, in a lot of the areas that we're hiring, it's worth having the conversation. Maybe talk to someone who works in that department now, learn about what it feels like, what kind of sense of community and purpose and difference you could make by hearing from someone else. So we'd love to have a conversation with anyone who's thinking about it. I worked in broadcasting originally, and then in telecommunications. I was working in telecom before I came here, and wasn't looking for a career in healthcare, but it has been such a rewarding change, and I'm so happy that I took the time to explore the opportunity and to make the dive in. It's been the most challenging position I've ever held, but by far the most rewarding.
Well, and I think it's really cool that somebody could actually call another human being. Is that what you're
Right.
suggesting? Is I could pick up the phone, a human being would answer, and then we could have a conversation and get to know each other before I went through the application process. Is that how it works, if I understand
Oh,
it correctly?
absolutely. Our human resources department is happy to do that, and same with students. If you're thinking about a career in healthcare, our human resources department can connect you with some job shadowing opportunities as well, to give you a good idea of what you might be getting into, or to help point your career in the right direction. I think that that's all part of the person-centered, not only care that we like to provide, but the person-centered workplace that we like to provide. We not only want to be the healthcare provider of choice, but also the employer of choice by the culture and the experience that we provide to patients and to staff, to just make this a really great place to give care and receive care.
Well, my daughter is a licensed. She just graduated from high school. She's a licensed CNA. She got that in high school. So maybe someday I can. She's pursuing her other stuff now after. So maybe someday I can give her somebody's phone number and she could call.
Oh, we'd love to talk to her.
All right. Well, thank you so much for your time. Anything else that you want to say? Anything else that you think is important that people need to know about Lake Region Healthcare?
Really just that we are here for you, and we are so um, privileged and happy to be able to provide care as an independent healthcare organization run, by locally governed by the people in this community, our board of trustees, our leadership. We are all here in the community looking for other people who love this community as much as you do and are invested in it like you are, to provide the healthcare services that you need. So we're happy to be here for you always.
All right. Well, we appreciate the time and hopefully we get to talk again soon.
I would love to. Thanks, Eric.
Thank you.